Now, here's Ed Bernstein.
Well, 1 out of 3 people over the age of 65 will slip and fall, and who knows what happens after that. And with me now to discuss that is physical therapist Scott Pensivy, geriatric director of Roseman.
Director of Geriatrics at Roseman.
Director of Geriatric at Roseman, Lisa Rosenberg, and R.J. Williams from the Balance Center at Physical, correct? You've been on before, and we've talked about balance and slipping and falling. And a little bit later on in the show, if you want to fall for something, we have a guest who used to sing with Prince, and now she's going to be over at the Smith Center this coming week, so you want to catch her. Falling and slipping, I mean, it seems that, you know, sooner or later, you're elderly, I mean, we all do it, first of all, right? So when you're elderly and you do it, then it has major repercussions, right, Lisa? And I mean, you see this in your practice all the time as a geriatric physician.
I do. It is actually such an important issue that when I meet a new patient, I'm careful, and I would say that about 95% of the time, I remember to say, we take falling very seriously as we get older because the consequences of falls are much greater. So I want you to call me, or I want you to call and let me know that you fell, and then I call you back, and over the phone we decide, is it worth an appointment? If you know a 10-year-old grandkid slams into the patient and they fall down, that might not be a balance problem. That's just a situation where if they, oh, I felt dizzy, I felt sick, then it probably needs some kind of evaluation. The consequences are that we're actually more likely to have intracranial bleeding as we get older, and that has nothing to do with hip fracture. The other scary thing with falls as we get older is that if an older woman falls down and breaks her hip, then her risk of dying goes up 20%. And if the same thing happens to an older man, his risk of dying goes up 30%. So it's not just an inconvenience that we fall and we might be uncomfortable for a while.
Right, and one of the things that you do, Scott, you're a physical therapist, and you work hand in hand on balance issues, dizziness, that type of thing, with the Balance Center.
Correct.
Right. So how does that work? You diagnose somebody and send them through the Balance Center.
Yeah. So there's different levels. There's a level 1, 2, and a 3. A level 1 would be somebody that my clinics are right now, and that is we assess them. We can do some easy balance things, you know, with cones and things like that. But the Balance 2 and 3, they actually have systems where they hook onto the person and hold them up on almost like a rail, so it's very safe for them. But they're much more apt to help those people that have a higher level of balance difficulties than what I see. And then Dr. Williams, his clinics, they have those harnesses. And when you go over there, they assess the balance and where their challenges are, and they put you in these harnesses to protect and able to participate in the activity.
And what was amazing to me, RJ, is that how some people can be cured very quickly with balance issues. I know that, like vertigo, for instance, you can resolve that relatively quickly.
Certainly. Depending on what the nature of the balance problem is that we see patients for, if it's a case of positional vertigo, which is something that our clinic does a lot of, that can be relatively 1, 2, 3 treatments. It has to do with kind of some mismatched signals in the inner ear. We correct for it, and as the body kind of reacclimates back to normalcy, the patient's dizziness symptoms can go away. So it can be on the spectrum of very, very short to correct to other cases that might take a little bit more of a program.
Now, Lisa, we all get dizzy. So how do you know, when you're seeing a patient, if this is just a ordinary course of, day-to-day life, or somebody has a serious problem?
So that's actually a really good thing to bring up, because a lot of older adults say, oh, well, everybody gets dizzy, or I'm 72, what should I, what else? Of course it happens. No, of course it doesn't happen. That's not normal. There are so many things that can be done. Sometimes the medications that work to control our blood pressure when we're younger aren't the right ones to control our blood pressure as we get older. The other issue is that if someone has always tolerated their blood pressure regimen and now they're having episodes of lightheadedness, is there a new cardiac issue? Are they drinking enough? Maybe they're new to Las Vegas and they are not used to how much you need to drink to stay healthy and well hydrated. So one of the things that older adults do, which I'm I feel like I'm constantly educating, like, no, we don't have to accept that you're dizzy. We don't have to accept that you have poor balance. There are things that we can do about it. And one of the lessons that we've learned over the years is that we sometimes let the blood pressure run a little high because the long-term risk of slightly higher blood pressure is nowhere near the risk of letting someone be dizzy a couple times a day and increasing the risk of fall and injury. So the big thing is it does happen, but we shouldn't live with it.
But as you get older, I mean, you get out of bed, and you get out of bed too quickly, you do get dizzy. I mean, isn't that somewhat common with elderly people?
It's more common, absolutely. And some of that is that we do tend to wake up relatively dehydrated because our body continues to drain itself, if you will. But just cardiac conditioning, just getting regular physical exercise helps our heart adjust to those positional changes. We've been flat all night, and then we sit up and we're excited, and maybe we have visitors or somewhere to be. And if we get up very quickly, we're much more likely to tolerate that if we're also physically active during the day.
How do we avoid running into these problems as we get older? Anybody?
So I think it starts with maintaining good physical activity through our entire lifespan. So we were discussing earlier the benefits of just a resistance and exercise-based program that keeps the body healthy. So it keeps your bones strong, keeps your muscles strong, keeps your heart strong. So those are the things that, as those things carry over into the older years of our life, are going to allow us to have the fortitude to sit up quickly in bed and not feel like you have this wave of dizziness come over you, because the body's healthy. And I think the next thing is just starting to have a conversation, whether it's with your family, whether it's with your doctor, making it something that isn't taboo and you can't talk about, but making it something that should be talked about so you can be preventative and proactive towards those things is extremely important.
And you have a clinic coming up, right?
Yes.
At your facility? Why don't
do.
you tell us about that?
So for actually the month of September in the physical therapy world and at FYZICAL, something that we take a lot of pride in is called Fighting the Fall. And as summer changes to fall, nationally we recognize it as Fall Prevention Month. So actually on September 24th, we're going to host a workshop at our Henderson office that is going to be all about falls and aging well and taking the right steps to stay healthy and safe as you move into your older years.
Right. So is there some sort of test or information you can administer to people attending this seminar to see if they need some follow-up treatment?
Definitely.
Yeah.
We have what we call a fall risk assessment that we'll be providing in addition to all of the educational pieces there to anyone that attends. So we're going to test their balance. We're going to screen them for any balance problems. If we uncover anything, then we'll be talking with that person about what steps they need to do, whether it's start with their doctor or start on an exercise and balance retraining program to start to curve it in the right direction.
Is there something I can do at home to at least give me an idea if I do have a balance issue?
Yep. So I always kind of come back to how do you feel during your daily life? Are you kind of couch surfing is what I call it, where patients are kind of hanging on to things as they walk around their house. That's an easy indicator that you're not confident about your balance. But we do simple things, and I want to stress the importance of doing this safely because you don't want to check to see if you have a balance problem and then fall. So make sure you have somebody nearby that can support you. You're doing it in a safe area. But even if just closing your eyes, you start to feel like you're very unsteady, or you have a difficult time standing on one leg for more than just a few seconds, those are simple tests that you can apply to yourself to see if you should get your balance checked.
Dr. Williams talked about resistance exercises. So, I mean, cardio is just not enough, is it?
No, you have to have some type of resistant exercise for a lot of different things. It helps stimulate the mitochondria, which gives us energy in the muscle system. It also builds bone, so we don't have osteoporosis, osteopenia. So it's very important that we do some resistant exercises.
A great number of these patients do have osteoporosis, right?
Yes.
Dr. Rosenberg?
Osteopenia and osteoporosis, yes.
And how do you normally deal with that? I mean, what are you looking for when you diagnose that, and how do you then work with the patient to minimize that.
Yes. So the best way to identify osteopenia or osteoporosis is by screening for it, as opposed to finding out after a fracture. If someone has fallen down, not off a 3-story building, but from standing to ground and breaks a bone, by definition, that's osteoporosis. What we do is look for reversible causes, so abnormal thyroid function. Certain medications absolutely increase the risk of having osteoporosis, either by blocking androgens or estrogens in the body, or some of them actually interfere with vitamin D metabolism, which is very important for bone health. So we look for the reversible causes. We counsel about appropriate amounts of calcium, which I'll do right now, which is calcium 500 milligrams twice a day. And the reason I say it that way is because the body can't absorb more than about 500 milligrams at once. So if you take it all in the morning, you're only getting half of it. But it's important to spread it out during the day.
For men and women, that's the
men
same
and
doses?
women. And vitamin D supplementation, and this is assuming that the vitamin D level is normal, which a person's doctor can check. 1 to 2,000 international units daily. If the vitamin D level is low, it is very important to treat the vitamin D deficiency. And then again, we're all singing the same song, but it's all about resistance exercises.
So do you recommend, I mean, you tell your patients to drink more milk. I mean, milk used to be great for you when I was growing up. Then it was not so good, and but now it's still a good source of vitamin D, isn't it? And calcium.
It's not as good a source as we like to think for vitamin D. So I think we get 25% in 8 ounces. Turns out that almond milk, and a lot of my patients for various reasons can't have milk. They're either lactose deficient or they say I don't like milk. But the almond milk is highly fortified. It actually has more calcium in it for every 8 ounces that you drink, and it still has vitamin D in it. So what I do is I ask patients, and I give them a little guidance. So is it 3 or 4 ounces of salmon has about 1/3 of your daily calcium in it. If you have a calcium meal, it doesn't make sense to take your calcium tablet with that meal because you simply won't absorb everything. Move the calcium tablet to when you're having a peanut butter and jelly, and you need the calcium with it. So it's also the case that patients don't need to take it in a pill if they can get it in their diet. So just reading the label and saying, hey, I bought bread that has 10% of my calcium in it in 2 slices, that's pretty good. So there's a lot that patients can do without popping more pills.
Now you told me something interesting earlier about what happens when you lie down too much or too long.
So we know that muscles waste. Anyone who's been sick and in bed for 3 or 4 days and then they go to stand up, they might be lightheaded when they first stand up. And that is because the heart actually became deconditioned in that very short period. The same happens with the skeletal muscles, and if someone is sick, lays in bed in the hospital for a week, they can lose up to 10% of their bone density depending on what the starting bone density was. So it turns out that being sedentary and sitting up is only a little better than laying down. It turns out being physically active, moving our whole body from one space to another is very, very important.
So when an elderly person is admitted to the hospital, are the hospitals now, familiar with this and try to get people moving?
They are, and I would say that we've come a long way. We're still not where we need to be, I think, in the inpatient setting. But there is a great movement towards getting older adults sitting up, because then the heart has to at least pump blood against gravity to get it to the brain. So it's better than laying down. And getting patients up and moving with supervision, either by a physical therapist, or if they're not there for a musculoskeletal reason, maybe a nurse walks them down the hall and back, just to prevent that horrible period of deconditioning, bone loss. It's also not good for our mood to lay around that much.
Of course not. But what happens if you do need a surgery, you do need to, rehab in a hospital and need to be lying down? Okay, now get discharged from the hospital. Is there a process that you can go through then to regain all that bone strength that you lost?
That's a tough question. It's much easier to lose our bone strength and density than it is to regain it. But resistance exercise, eating right when one is in the hospital. If someone is in the hospital for, let's say they have a lower extremity injury, just doing light weights. Ask for 2 20-ounce water bottles and do it while your TV program is on, since there's not much else to do when you're laying in a hospital bed.
And RJ, when an elderly person begins to lose their hearing and their sight, aren't those warning signs about a potential falling?
So those are, when we look at the big picture of everything too, vision is one of the key balance systems. So we look at 3 systems. I mentioned the inner ear earlier, but vision is very, very important. And we know vision starts to go as we get older. There's many things that can cause visual problems. But that is, part of the tripod that our balance system is based off of. And then the third piece is your sensation from your extremities. So also another problem that we see with older adults is they start to lose sensation in their feet, like with peripheral neuropathy and things like that.
Right.
So we want to look at those pieces, but also hearing helps us stay engaged with our people, our family, our loved ones. And the more we start to also kind of get disconnected from that, we're seeing some studies out of our clinic that we pay attention to is relationships with cognitive health and hearing loss. So the more disconnected a person starts to become, the more the cognitive side of things can start to come on as problematic as well.
Yeah. And we should add, this does not only affect elderly people, right? I mean, you work with a lot of patients who have been in automobile accidents or have fallen already, and they have, balance issues as a result of an incident.
Right. Even our pro athletes, people would think that, a pro athlete, they're running on the field and everything's great, but we've taken athletes that are, we think, top notch, and we've tested them, and they fail our system. So.
And I know you recommend anybody that has any kind of head injury to be checked out.
That's correct.
Because you can be symptom-free after having a concussion and then develop problems later.
That's correct.
Right?
Yes. Yeah, there's a 92% chance of having a vestibular concussion once you have a cerebral concussion, and that's it. Going back to the balance issue.
Now, I don't know if we mentioned, did we mention, RJ, if you'd like to receive a free report on this, you can text dizziness to 44222.
Correct.
Right?
So
and you'll get back to somebody, right?
We wrote a free report that's just how to minimize your risk of falls inside your home. Okay. So if you text that number, it'll just ask you for what email you want us to send it to, and we'll send it right over.
Thank you very much.
Yeah.
That's great.
Thank you, Dr. Williams, Dr. Rosenberg, Dr. Pensivy. Thank you very much.